I'm Kathryn Bradbury and I'm a nutritional epidemiologist. What we found is that people who eat red or processed meat daily have a 40% increased risk in developing bowel cancer compared to people who eat red or processed meat once a week or less. We looked at people who were participating in UK Biobank, which is a study of 500,000 middle-aged men and women throughout the UK, and so we found that people who ate red or processed meat daily were much more likely to get bowel cancer than those who ate it just once a week or less. Yes, so we found also that people who do eat red or processed meat daily are a bit more likely to smoke, drink a bit more alcohol and do a bit less physical activity. So it's important that we take that into account when we're doing our statistical analyses, and so we do take those other lifestyle factors into account so that we try to just isolate the effect of meat on bowel cancer. It's not completely clear yet, but there are a number of compounds in red and processed meat that might help explain why people who eat a lot are more likely to get cancer. So some of them in processed meat, might be simply the salt, the high salt content. Another culprit may be the heme iron, and there's also some compounds that are created when you grill or fry meat at high temperatures that may be suspected that they might be carcinogenic. Well, one of the most important things that people can do is if they smoke, is to stop smoking. That really has a large effect on lung cancer, but also on other cancers. In terms of diet, I think if you do eat a lot of red and processed meat, it probably is a good idea to cut down, to reduce your intake, and probably eating a bit more plant sort of based, whole grains, fruits and vegetables is a good idea. Well, we're interested in looking at some other factors in relation to bowel cancer as well. So what UK Biobank has done is they've collected blood samples from all 500,000 participants, and so we're going to be looking at vitamin D in the blood and looking at that in relation to bowel cancer. So there's lots of work that can be done.